Good afternoon, Lewis and Clark County residents. I'm Drenda Niemann, Health Officer for Lewis and Clark Public Health. As you may have already heard, the federal public health emergency for COVID-19 expired May 11th. More than 3 years ago, after its original declaration, the World Health Organization ended the global emergency status for COVID-19 on May 5th. However, the virus has killed more than 6.9 million people. And to date, over 1.1 million COVID-19 deaths have been reported in the United States. And we continue to lose more than 100 US residents to COVID daily. In Lewis and Clark County, COVID-19 claimed the lives of 205 of our friends and neighbors. While the emergency is over, COVID-19 is not gone. And we will manage COVID-19 like other infectious diseases that impact the health and well-being of our community. So there's a few changes that you can anticipate here in the short term. The first is related to the data that we report out to the community. So starting on May 12th, our Lewis and Clark County COVID-19 hub will reflect the case dashboard that will no longer be updated, and it will be directly linked over to the CDC's COVID-19 data tracker. The most notable data changes made by the CDC and adopted by Lewis and Clark Public Health are related to the hospital admissions. Those levels will replace the COVID-19 community levels as the main indicator of county trends. So as you're watching, the green, yellow, and red indicator is directly hooked back now to hospital admissions. Hospital admission rates and the percentage of COVID-19 deaths are the primary surveillance metrics. Lewis and Clark Public Health will continue to report and monitor valuable data like vaccine coverage, as well as wastewater surveillance for the Helena and East Helena wastewater systems. This data will continue to be posted to our COVID-19 hub. An additional change to watch out for is that our COVID-19 hotline at 833-829-9219 and our COVID testing center out at Lewis and Clark County Fairgrounds will be open through Friday, June 30th. However, after that, we're going to close both of those down, and they'll be retired indefinitely. So what doesn't change? The risk of COVID infection is still with us, which means that we still need to implement all of those prevention strategies that we've talked about over the last 3 years. So the best way to protect yourself and others from COVID-19 remains the same. And we encourage yourself and your family members to be vaccinated and to stay up to date with your boosters. If you do test positive for COVID-19, stay home. We ask that you follow the recommendations of the CDC and Lewis and Clark Public Health, and it's based on your vaccine status. And those are put in place so that you avoid exposing others to the virus as well. I also encourage that you contact your medical provider right away, because there are really good treatments still available. And those treatments, if started early, will help to reduce the duration and severity of the illness. If you're at high risk of getting very sick, wearing a high quality mask will also help. And then please also wash your hands. Also, COVID is still a reportable disease in Montana. So if you do test positive, send that information our way. We will continue to track the disease in our county. For now, vaccines are still free. We will keep you informed if and when that changes and where you'll be able to receive a COVID-19 vaccine and booster in the future. But for now, we do have a COVID-19 bivalent booster clinic coming up on May 20th. That will be held at Central Elementary School from 10 a.m. to 2 p.m. and it's by appointment only. So appointments can be made online through our Lewis and Clark COVID-19 hub or by calling our hotline at 833-829-9219. The clinic is open to the following individuals who fit into these categories. So people 65 years and older who received their last COVID-19 booster 4 or more months ago. People 12 years or older and immune compromised who received their last booster 2 or more months ago. People 12 or older who had their last COVID-19 vaccine before September of 2022. And then people 12 years or older who have never received a COVID-19 vaccine. So those are the folks that need to log on as soon as possible and get your appointment made for the vaccine clinic this Saturday, the 20th. So remember, an updated vaccine can protect you and your family members and our community at large from severe COVID-related illness, hospitalizations, and death. We will keep you informed as we continue in our mission to improve and protect the health of Lewis and Clark County residents. Thank you.